Tonight's topic is musculoskeletal, skin, and connective tissue. Leading our session once again this evening is Paras Vicaria, and he's going to introduce himself now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I am a dermatology resident currently at UT Southwestern here in Dallas, Texas. I originally graduated from pharmacy school, then went back to Michigan to do my medical training. And I'm also an RX coach, so I work with USMLE-Rx, and I work one-on-one with students to help prepare them for the USMLE Step 1 and Step 2 CK as well, and I'm happy to help lead tonight's session.
Tonight's topic, however, is MSK, and we're going to go ahead and get started. I know we mentioned RX Coach already. RX Coach is our coaching program. We work with students one-on-one to help them accomplish their academic goals. We'll talk more about that later, but what you should know for now is that the methodology we will employ as we do our 4 questions this evening will be the same methodology that we employ in our coaching sessions. So without any further ado, let's go ahead and get into our first question this evening. As you can see, the answer choices are covered up. That is by design. We cover them up because we do not want you to be distracted by the answer choices. We don't want them to dictate your thought process, and we don't want you to panic if you see an answer choice that you are unfamiliar with. So once we cover up those answer choices, we begin by reading the lead-in, and the lead-in is the last sentence or the question itself. So let's do that now. Which of the following prominences most likely failed to fuse, resulting in this patient's presentation? We read the lead-in first because we want you to know what the test writer is asking as you read the vignette, so you can pick up on all those relevant clues and prevent yourself from having to reread that question and waste time. So once we read the lead-in, which we've just done, we like to ask our students how many steps they believe this question will require. An example of a 1-step question could be where you're asked for the diagnosis. An example of a 2-step question could be where you're asked for the treatment for a diagnosis. And an example of a 3-step question is when you're asked for the mechanism of action for a treatment for a diagnosis. So with those examples in mind, please let us know in the question box how many steps you believe this question will require, and then we'll read the vignette. All right, I see the responses coming in. Let's read that vignette. A 3-year-old boy is brought to the pediatrician for a well child checkup. He and his family recently immigrated to the United States. Physical examination reveals a gap in his left upper lip. When the boy closes his lips, his left central and lateral incisors are visible. His nares, palate, tongue, and sublingual area are intact. No other abnormalities are noted. Which of the following prominences most likely failed to fuse, resulting in this patient's presentation? I'll give all of you a few moments here to start thinking about the relevant and most important clues in the vignette, as well as lead-in, as I hand it off to Paras.
Thank you, Sean. So we will go ahead and show you what we think are the important clues in this vignette and the lead-in. So starting off, we have a 3-year-old boy. Anytime they give you demographics, and they usually give that to you right off the bat, it's important to make note of that and highlight that, because automatically that'll give you some clues as to what's going on, okay? And then they give us some social history here, especially about being a recent immigrant, okay? So that's obviously going to be important. Whenever they give you important social history like that, always important to make note of it. Then they give us some important physical exam findings, and those are important to make note of as well, okay? So then they're asking us which prominences most likely failed to fuse. So how many steps is this question? Well, 1, I think we need to figure out what's going on with this patient based on his presentation. And then 2, based off of that condition, which prominences most likely failed as a result. So I would say likely a 2-step question here. So let's go ahead and take a look at the answer choices. And we have 5 answer choices here. So I'm going to go ahead and read it out loud. But what I'm going to do is I'm actually going to start at the bottom, and I'm going to work my way up to the top. So from answer choice E to A. And we recommend students do this as well. You know, a lot of times we'll see students who will start at the top, they'll see something they like, and then they'll select it without going through all the answer choices. So doing it this way prevents you from doing that and prevents you from biasing yourself as well. So let's go ahead and do that now. Answer choice E, maxillary and medial nasal prominences. D, maxillary and lateral nasal prominences. C, mandibular and medial nasal prominences. B, bilateral medial nasal prominences. And A, bilateral lateral nasal prominences. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paras. So once again, we're going to wait until about 2/3 of you have responded. Keep in mind that all of your responses are completely anonymous. And remember also that on test day, you should never leave a question blank because there is no penalty for guessing, only points for correct answers. So never leave a question blank there. And if for some reason you're unsure of the answer tonight, don't worry, take your best guess, and we will walk through the incorrect and correct answer choices here in just a little bit. All right, let's take a look and see what you selected. Looks like it was close. 42% of you selected E, maxillary and medial nasal prominences. And in second place with 36% of you choosing was answer choice D, maxillary and lateral nasal prominences. So let's take a look and see what the correct answer is. And the correct answer is indeed E, maxillary and medial nasal prominences. And 42% of you got it right, so great job. But let's make sure you got it right for the right reasons. And if you didn't, don't worry. Listen to Paras now, and you'll knock it out of the park on test day. Paras.
Thank you, Sean. Yes, great job, guys. So this is a nice question here. So they give us some important information. He's got a gap in his left upper lip. When he closes his lips, you can see his left central and lateral incisors, okay? They then tell us that his palate, his sublingual area, tongue, and nares are all intact. So this is definitely pointing towards a diagnosis of cleft lip, okay? A patient with a unilateral gap or split in the lip, okay? A cleft lip is commonly caused by a failure of a couple things. So on the next slide, Sean has actually gone ahead and pulled up the table from first aid that actually talks about the orofacial clefs, okay? Specifically cleft lip and cleft palate. You can see there under cleft lip, it's due to failure of fusion of the maxillary and medial nasal prominences or processes, okay? And you can see exactly on that image what that would lead to, okay? So it's the maxillary prominence, or the green in that diagram, as well as the medial nasal prominence, which is the orange that Sean is drawing out. So hopefully you can see how if those two do not fuse, you could have a cleft lip, okay? So let's talk about why the other answer choices are incorrect. So answer choice D. This would actually cause a gap between the middle face and the lateral nose. So you would have a facial cleft kind of near the nasolacrimal duct, not what we're seeing in this patient. Answer choice C, if this were to happen, this is responsible for tissue including and below the lower lip, okay? So not the upper lip like this question. Answer choice B, this would cause a failure of fusion, but this would be directly midline, okay? We're told that this is a lateral lesion. It's the left upper lip. We can see his lateral incisors, so we know this is not directly midline in that upper lip. So it's less likely to be this and more likely to be answer choice E. And lastly, answer choice A. This is actually incorrect. They do not fuse together, those two lateral nasal prominences, so that's kind of just a incorrect answer choice overall. So hopefully you guys see why answer choice E here is the best answer.
Excellent. Thank you, Paras. Great job, everyone. Let's go ahead and move on now to our second question of the evening. Once again, we do have a raffle at the end, and one lucky winner will win a valuable prize. We also have a special offer for all of you in attendance, but tonight we'll also be announcing the winner of our self-assessment week. So make sure you stick around and claim your valuable prize. Once again, the answer choices are covered up. That is by design, and we will begin with the lead-in. Which of the following is the most likely etiology of the skin lesions in this patient? Which of the following is the most likely etiology of the skin lesions in this patient? I'll give all of you a few moments here to let us know how many steps you believe this question will require. And because I prematurely jumped ahead, you already know what the important clues are. I see the responses coming in. Let's go ahead and read that vignette. A 6-month-old Chinese child is brought to the clinic for a checkup. He has been developing well. Physical examination reveals the findings shown, which were also present at birth. Which of the following is the most likely etiology of the skin lesions in this patient? And with that, I'll hand it off to Boris.
Thank you, Sean. So, now we have a different question here. So even a younger patient, so we have a 6-month-old child. And on top of that, they're actually giving us that this is a Chinese child. So whenever they give you something unique like that, it's always important to make note of that, okay? Then they're basically getting right to the point here, saying, they're showing us this image with the findings. Then they're asking us in the lead-in, the most likely etiology of the skin lesion. So how many steps is this question? Well, 1, I think we need to figure out what are these skin lesions, and then 2, what is the etiology, what's the pathogenesis of those lesions? So probably a 2-step question here. So let's take a look at those answer choices. So we've got 5 answer choices here. So once again, I'm going to go ahead and start at the bottom, and I'm going to work my way up to the top. E, local clonal proliferation of dysplastic melanocytes. D, increased density of melanosomes within melanocytes. C, increased alpha melanocyte stimulating hormone. B, extravasation of blood. And A, defect in migration of neural crest cells. So we're going to go ahead and open up that poll. Go ahead and select what you think is the most likely etiology, and we'll talk about it in just a few seconds.
Great, thank you, Paro. So once again, we're going to open up that poll and wait until about 2/3 of you have responded before we go over the correct and incorrect answers. Remember that when you're doing practice questions, it's important to not just be like, okay, I got it right, let me move on. Make sure you got it right for the right reasons, and make sure you read all of the explanations so that you can learn from the incorrect choices as well. And we'll go over here in just a little bit, our new format, which should really make the explanations more useful to you, as well as easier to navigate and keep organized. So looking forward to showing you that once again later this evening. All right, I see all of you have voted. Well, most of you have. Let's take a look and see what you selected. Looks like 39% of you selected increased density of melanosomes with melanocytes. And in second place with 27% was defect in the migration of neural crest cells. So let's take a look and see what the correct answer is. And the correct answer is A, defect in the migration of neural crest cells. And 27% of you got it right. So a challenging question indeed, but don't worry, pay attention to Paras, and you'll be able to master it. Paras.
Thank you, Sean. Yeah, definitely a tough question here. So let's take a look at this question again. So what is going on in this picture? Well, this is something that's often referred to as Mongolian spots, and the technical term is dermal melanocytosis. Specifically, in this case, it's congenital. So dermal melanocytosis. So hopefully you guys are starting to pick up a little bit on what that could mean. So it's a benign finding, oftentimes presents at birth. And you can see why they call it Mongolian spots and why they were saying this patient is Asian. It is usually seen more commonly in Asian, Hispanic, and Black children. Dermal melanocytosis usually kind of presents like these blue-gray patches that you can see oftentimes on the lower back or buttock areas, okay? And as they get older, these patches fade, okay? So what is the mechanism or the pathogenesis of this? Well, normally you have neural crest cells that make their way up through the dermis and try to get to the epidermis where they will then reside. However, what can happen is there can be a defect in that migration. So they get stuck or remain in the dermis. So that's why it's called dermal melanocytosis. These neural crest cells, which would have gone on to become melanocytes in the epidermis, are actually just stuck in the dermis, okay? So the correct answer here, as you can see, would be A. Let's talk about the other answer choices and why those would be incorrect here. So E, a local clonal proliferation of dysplastic melanocytes. Well, that would be getting more at a mole or a nevus that is dysplastic or atypical. And that's not really what we have here. That would be more of a dark brown macule and not so much these, blue-gray patches, okay? Answer choice D, increased density of melanosomes within melanocytes. That's actually a normal thing that can happen, and that's what causes variation in skin color. So people who are of darker skin type or phenotype usually have more density and activity of melanosomes within melanocytes, okay? Answer choice C, increased alpha MSH. This would actually result in generalized hyperpigmentation. This is something you can see in Addison's disease, if you remember, but this would be more generalized diffuse hyperpigmentation, okay? Answer choice B, extravasation of blood. That's getting more at bruising, which is not necessarily what's going on here. This is getting specifically at skin lesions, specifically dermal melanocytosis. So hopefully you guys are able to understand the pathogenesis and are able to use some of your dermatologic knowledge and tools and words to pick up on what's going on in this picture.
Excellent, thank you, Paris. So it's nice to have a dermatologist explaining the skin lesions to us. So all of you are very lucky this evening. So I know we mentioned RX Coach earlier, and RX Coach is here to help you on your academic journey, whether your journey is currently, you're at the stage of you're in medical school still, trying to figure out the best way to study, you're taking exams in medical school, you're studying for shelf exams, you're studying for your comp, you're studying for step 1 or step 2 or COMLEX, we're here to help. So if you're currently in medical school, what we'll do is we'll get your syllabus from you, and we'll have you fill out a questionnaire, and then we'll help create a personalized study plan to make your study more efficient. And then we'll work with you to make sure that you're mastering that material and can apply it in the form of answering questions. If you're studying for a comp or for a board exam, we'll actually administer one of our assessment exams, and we're one of the only companies that has created their own assessment and does tutoring, right? And so that allows us to use the data that we've compiled over the years to help make a personalized study plan and then work with you and take a data-driven approach to make sure that you're studying effectively, efficiently, and can not only learn, but also apply what you have learned. And by working with you, we're able to identify your knowledge gaps and bridge them. And of course, like I mentioned, we do also work on your test taking skills. So whether you're already doing great and you want to do greater, whether you're not quite where you want to be and you want to do better, we're here to help. So if you want the expertise and the guidance of an experienced coach like Boris or Alec or Brian, reach out to us at rx-coach or rx-coach.com. You can click on the free consultation tab, and you'll be able to have a free consultation with us to talk about the program, how it can benefit you. And once again, that consultation to discuss the program is absolutely free. That website, once again, is rx-coach or rx-coach.com. A lot of people consider tutoring, and the one thing I'll tell you is whenever you're looking at hiring a service, always look at the experience that they have. We were in medical education for almost 30 years before we started tutoring. Our founders have authored first aid, we've created question banks, bricks, express videos, and flashbacks. So we have the experience and the data that we need to really help you succeed. So if you're wanting to get that edge and maximize your potential, we're here to help. Let's go ahead and move on to our third question. I will remind you that we have a raffle at the end of the evening tonight. One lucky winner from our crowd this evening will win a very valuable prize. We also have a special offer for all of you, as well as the announcement of our winner from our free self-assessment week. So make sure you stick around. With that, let's go ahead and move on to our third question of the evening. Once again, the answer choices are covered up, and we will begin with the lead-in. Which of the following cell types is most involved in the pathogenesis of this patient's disease? Which of the following cell types is most involved in the pathogenesis of this patient's disease? Once again, I'll give all of you a few moments here. But let us know in the question box how many steps you believe this question will require. And then we'll move on to the vignette. All right, I see the responses coming in. Let's go ahead and read that vignette. A 50-year-old woman comes to the clinic with knee pain for 2 months. Her pain is worse at the end of the day and is relieved with rest and ibuprofen. She works as a clerk and is mostly sedentary. The patient is 170 centimeters or 5 feet 7 inches tall and 93 kilograms or 205 pounds for a body mass index of 32.1. X-ray of the knee is shown. Which of the following cell types is most involved in the pathogenesis of this patient's disease? Please take a moment to start thinking about the most important and relevant clues in the vignette and lead-in as I hand it off.
Thank you, Sean. So I'll go ahead and show you guys what we think are the important clues in this vignette and the lead-in. So again, demographics. So now we have an older patient, a 50-year-old woman. What is her main symptom? Why is she coming to the clinic? Well, she's got knee pain. It's always important to make note of why they're coming there to the clinic, to the hospital, to the emergency room, and then also the duration. So specifically in this case, it's been going on for 2 months, okay? They then give us some more information about the pain, when it's worse, what it's made better by. They give us some occupational and social history. Always important to make note of that, especially when it's relevant like this. And then some physical exam findings and an X-ray image there. So then they're asking us in the lead-in, which cell type is most involved in pathogenesis? Okay, so how many steps is this question? I think one, we have to figure out what this patient's disease is. And then 2, I think we need to know the pathogenesis of this condition. And I think maybe 3, you could argue that, the specific cell type within that pathogenesis. So I think maybe a 3-step question here, at least 2. So let's take a look at those answer choices. Answer choice E, T cells, D, neutrophils, C, macrophages, B, eosinophils, and A, B cells. So we're going to go ahead and open up that poll. Go ahead and select the answer choice that you think is the best answer, and we'll talk about it in just a few seconds.
Excellent, thank you, Paras. So once again, the poll is open and we'll wait until about 2/3 of you have responded. And then we'll go over the correct and incorrect answer choices. Once again, next week's topic is cardiac physiology. And the week after that, we will actually be doing a question lab on step 2. So make sure you tune in every Tuesday at 8 p.m. for our question labs. All right. Let's take a look and see what you selected. Looks like we have a front runner, which is C, with 45% of you choosing macrophage, and 25% of you selected neutrophils, and in a close third place was T cells. So let's take a look and see what the correct answer is. And the correct answer is indeed C, macrophages. Well done, 45% of you got it right. And with that, I'll turn it back over to Paras.
Thank you, Sean. So let's take a look at what's going on. So step number 1, what is this patient's disease? Well, they gave us some important clues there. They gave us some knee pain. It's worse during the at the end of the day, it's relieved with rest. She's mostly sedentary and she's obese. So this is probably getting at osteoarthritis, or OA, okay? And you can see there in that image that that joint space between the two long bones, you actually have some narrowing of that joint space. It's not, you don't have a lot of nice space on both ends of that joint, okay? You also, if you look very closely at the very from our view, the left side of that picture, along that rim, you can see a little, some few osteophytes there as well, okay? So this is likely osteoarthritis, okay? So then what is going on in osteoarthritis? Well, in osteoarthritis, you have mechanical joint injury that leads to the innate immune system activating macrophages, okay? And this is mediated by certain cytokines. This inflammatory process then leads to the destruction of articular cartilage, osteophyte formation, bone sclerosis, and other degenerative changes, okay? So let's take a look on the next slide. Sean has gone ahead and pulled up the table on osteoarthritis from first aid. So you can see there under pathogenesis that mechanical damage, wear and tear, it destroys the articular cartilage, and that leads to inflammation with inadequate repair, okay? So that's the pathogenesis of this. Now, let's take a look, in case you were wondering why it's not one of the other answer choices, let's take a look and talk about those choices. So, answer choice E, T cells, and actually as well, answer choice A, B cells. T cells and B cells are involved more so in chronic inflammatory disorders. So rheumatoid arthritis, arthritis that's due to lupus, not osteoarthritis. Answer choice D. This would be correct in the setting of an infection or septic arthritis, but that's clearly not the case in this patient. And then lastly, eosinophils. This is something where you would expect to see that in an allergic reaction, a parasite infection, maybe an immune disorder that's eosinophil mediated, like eosinophilic granulomatosis with polyangiitis, or EGPA. That's something where you could see eosinophils, but that's not the constellation that's going on in this patient. So majority of you guys got this question right, and nice job. And I'll hand it back to you, Sean.
Excellent. Thank you, Paris. So, earlier I mentioned how we have a new format of question explanations within our question bank QMAX. And as you can see here, this is a two-step question. So you have the disease diagnosis and then the disease mechanism. Now, this is just the explanation for the correct answer choice, and there are other explanations for the incorrect answer choices. So this is our new format. As you can see here, we have it laid out, the explanation in two separate steps: the diagnosis, where we likely say the patient likely has osteoarthritis, and then mechanism. We talk about mechanical joint injury, just like we showed you in first aid, and of course, the correct answer, macrophage. We have a brief explanation here of the incorrect answer choices, but there are more in-depth explanations of the incorrect answer choices as well. So a nice little preview here, and I'm sure Jeff will talk more about this later. So with that, let's go ahead and move on to our last question of the evening. I will remind you that we do have a raffle at the end of the session. One of you will win a very valuable prize. We also have a special offer, and we will also be announcing the winner of our self-assessment week. So make sure you stick around. Let's try to finish strong with our last question this evening on MSK. Once again, the answer choices are covered up, and we will begin with the lead-in. Which of the following serum studies is most likely to be elevated in this patient? Which of the following serum studies is most likely to be elevated in this patient? I'll give all of you a few moments here to let us know how many steps you believe this question will require. We'll move on to the vignette. All right, I see some responses coming in. Let's go ahead and read that vignette. A 38-year-old woman comes to the clinic with increasing upper arm and neck weakness and increasing dyspnea for 1 month. On physical examination, deltoid and quadriceps strength are 2 out of 5 bilaterally, and she has an erythematous rash on both eyelids. There are diffuse fine crackles on lung examination. Which of the following serum studies is most likely to be elevated in this patient? I'll give all of you a few moments here to start thinking about the important clues in the vignette and lead-in as I hand it off to Parth.
Thank you, Sean. So once again, we're going to show you what we think are the important clues in this vignette and the lead-in. And so this is, our fourth question, and hopefully you guys are getting a sense of what we think are the relevant clues in the vignette and lead-in, and what is worthwhile highlighting and maybe not as worthwhile to highlight, so that when you go back and take a look at the question, you'll have highlighted everything that's important in that question, okay? So let's go ahead and do that one more time. A 38-year-old woman, why is she coming to the clinic? Upper arm and neck weakness, okay? And dyspnea as well. How long has it been going on for? 1 month. All important to make note of. They then give us a variety of physical exam findings, and all important to make note of as we are trying to answer this question. So they then ask us which serum study most likely elevated. So how many steps is this question? Well, I think one, we need to figure out what's going on in this patient, what's the condition or diagnosis. And then 2, based off that, what serum study could be elevated in that condition or diagnosis? So I think this could be a 2-step question here. So let's take a look at those answer choices. And once again, we're going to go ahead and start at the bottom and work our way up to the top. Answer choice E, anti-nuclear antibodies. D, anti-mitochondrial antibodies. C, anti-centromere antibodies. B, anti-IgG antibodies. And A, anti-double-stranded DNA antibodies. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here, and we'll talk about it in just a few seconds.
Great, thank you, Parth. So this is our last question of the evening. Let's try to finish strong. Once again, we'll wait until about 2/3 of you have responded. And then of course, we will have our raffle. We'll announce the winner from our self-assessment week and share with you our special offer for all of you that are in attendance. Next week's topic, once again, is cardiac physiology, which will then be followed by step 2 the following week. You see the responses coming in. We'll give all of you a few more moments here. All right, let's take a look and see what you selected. Looks like we have a clear favorite with 40% of you selecting anti-nuclear antibodies. And in second place, we have anti-double-stranded DNA antibodies. And in close third place, we have anti-mitochondrial antibodies. So let's take a look and see what the correct answer is. And the correct answer is E, anti-nuclear antibodies. And 40% of you got it right, so great job. Let me hand it off to Paris so he can explain all of these to you. Paris.
Thank you, Sean. Great job, guys. Definitely a nice question here. Definitely another derm correlate as well. So what does this patient have going on? Well, hopefully you picked up that, first and foremost, she is having proximal muscle weakness. Deltoid and quadriceps strengths are not very good bilaterally. It's symmetric. She also has an erythematous rash on both of her eyelids, okay? They also tell us about some lung findings as well. So hopefully you guys were picking up that this was dermatomyositis, okay? It is an inflammatory muscle disease. It leads to proximal muscle weakness symmetrically, and this classic rash can be seen on the eyelids, and this is called a heliotrope rash. On the next slide, Sean has actually gone ahead and pulled up the table from first aid talking about some of these myopathies. Specifically, you can see dermatomyositis there, okay? So you can see it does talk about that heliotrope rash, which is a violaceous to erythematous rash of the eyelids, okay? There are some other cutaneous findings of dermatomyositis, but they didn't necessarily give that to us in this question. But they did give us one characteristic one, so it's important that you're able to recognize all of them, okay? Other things, so now when you look at dermatomyositis, you know, it can often be associated with a malignancy and also with lung disease, specifically interstitial lung disease. So that's probably why she was having dyspnea as well as crackles, okay? Now, if you look at the very top, it tells you some of the antibodies and serum studies that you can find. And a positive ANA or anti-nuclear antibody can be seen. There are some more specific antibodies or autoantibodies as well, but they didn't give those to us as an answer choice, okay? It's important to know those, but they didn't give that to us, so the best answer choice in this question would be ANA, okay? Let's go back to the vignette, take a look at the other answer choices, and talk about maybe what those conditions are with those answer choices. So, anti-mitochondrial antibodies, that's something that you would see with primary biliary cirrhosis. So more of a GI issue. Anti-centromere antibodies, this is something you could see in systemic sclerosis, okay? But keep in mind there would be other cutaneous findings of that, especially if it's the limited form. So calcinosis cutis, Raynaud's phenomenon, telangiectasias, to name a few. Anti-IgG antibodies, this is something that would be associated with rheumatoid arthritis, and those anti-IgG antibodies are probably getting at rheumatoid factor. You know, there can be other anti-IgG antibodies involved in a variety of other diseases, but so a little non-specific here specifically. And then lastly, answer choice A, anti-double-stranded DNA antibodies. This is getting at likely systemic lupus or systemic lupus erythematosus or SLE, okay? So maybe you were thinking that that erythematous rash on the eyelids was SLE or lupus, but keep in mind, one, that the lupus rash is usually more of a malar rash as well, okay? And you can also often see a malar rash in dermatomyositis. So you need to use a lot of those clinical findings to differentiate the two. And in this issue, that proximal muscle weakness doesn't really fit with lupus. So the best answer choice here is depending on picking up this as dermatomyositis and then knowing that one of the non-specific tests that's positive is an ANA test. So great job overall today, guys. I will hand it back to Sean.
Excellent, Boris. Thank you very much. Great job tonight, everybody. We had some challenging questions, but hopefully you found tonight's session to be helpful.